Hello, I'm going to start my presentation, my research presentation for 46 on thyroid disorders. Okay, what does the thyroid gland do? The thyroid gland, it makes hormones. T3 and T4 are the two primary hormones it makes. It regulates a lot of your bodily functions that all tie into metabolism, like breathing rate, heart rate, digestion, body temperature. It also regulates when you're younger the growth and development of your body, that rate. And iodine deficiency is the number one problem with underdevelopment of the brain and in children. Okay, what is a thyroid disorder? A thyroid disorder is any abnormality at all with the thyroid. There are tons of different thyroid disorders. You can have hyperthyroidism or hypothyroidism, which is just whether or not your thyroid is overactive or underactive. You can have a goiter, which is an enlargement of the thyroid gland caused by lack of iodine. Another one thing you can have is a thyroid nodule, which is a lump in the thyroid gland. It's like a fluid-filled cyst, and they're very, very common. And the chances of you getting them they increase as you get older. Also, they can possibly be cancerous. Thyroid cancer isn't very common though. It only occurs in about 7%, I think. 6 or 7% is what I saw of people with thyroid nodules. And thyroiditis is another problem people have. It's one of the big ones. It's autoimmune problems with the body attacking the thyroid gland for whatever reason. Okay, now we're going to move on to the causes of thyroid disorders. You can have genetic and non-genetic causes of thyroid disorders. If you have parents with thyroid problems or grandparents with thyroid problems, or you could possibly have thyroid problems. I think the increased risk is only like 15 to 25% from what I've seen. Um, and that's genetic. The genetic problem is like defective production of the thyroid hormone specifically, and the non-genetic problems are the underdevelopment of the thyroid gland that's congenital from birth, a missing thyroid gland which is congenital from birth, and then a thyroid gland that's not located where it should be. It's just not proper articulation of the thyroid gland, and then the pituitary gland malfunction is the interesting one, and that's where your pituitary, which is on your brain, doesn't properly release a thyroid stimulating hormone, and then therefore that's the underlying cause of your thyroid problem, is the fact that it's not being stimulated to produce enough hormone, or it's being overstimulated to produce too much hormone. And then also cancer can obviously affect how these cells physiologically um, produce hormones. So all these things affect how the cells work in the thyroid gland. And then another cause of the thyroid disorders are autoimmune disorders, which is when your immune system accidentally attacks cells that are good, and because they think they're bad. And two examples of that is Graves' disease, which actually causes hyperthyroidism, and then Hashimoto's disease, which causes hypothyroidism. Okay, these are the signs and symptoms of thyroid disorder. For hyperthyroidism, you can have people with nervousness, tremors, the reduced ability to concentrate, a racing heartbeat, inability to tolerate extreme environments, especially heat. Aches and pains is a general one for both, due to like inflammation of the thyroid gland, and then diarrhea. And you can see that hyperthyroidism ties well to an overactive metabolism, like diarrhea, heat intolerance because you're producing enough of your own heat, racing heartbeat, and then the reduced concentration is supposed to stem from the fact that when your cardiac output's higher, there's more blood going to your brain, and it's said that it can actually accelerate the speed of thought, but then it can reduce your ability to concentrate. And then for hypothyroidism, it's the exact opposite. People have mental fogginess. They are able to easily concentrate, but then it's very hard for them to actually understand new or novel tasks. Um, There are other symptoms of hypothyroidism like weight gain, high cholesterol, feeling cold because you're not producing enough of your own body heat, constipation from slowed metabolism, and these are the general symptoms. And these symptoms are often not apparent in most cases. It's like a bell curve effect where you have to be on very close to both ends of the spectrum to experience most of these symptoms. Most people fall under the center where your thyroid's fine, but when you're towards the very edge of each side, you'll experience more symptoms from the one side of this diagram than the other side. And then there are some pictures here that you guys can look at that help you out. Okay, these are the ways you diagnose thyroid disorder. You can test for T3 and T4 concentrations, and the parts per million will tell you whether or not overall your thyroid's hyperactive or hypoactive. Um, the needle biopsy test takes a sample of your thyroid, and it will tell you what's causing the inflammation, which is generally the cause of these thyroid disorders, and whether or not you have an infection, or you're sick, or you just have an autoimmune disorder. The thyroid scan and uptake is a little bit like the cardiac cath lab's concept of an injection of iodine, where you can see the blood flow through the heart with an iodine injection. But with this isn't iodine, but this is radioisotopes, where you do that injection and you can actually see the size, shape, position, and function that a lot of other imaging procedures wouldn't be able to see. But this is this is a pretty expensive procedure, so not a lot of people get it. The fourth one's ultrasound, and you guys should know what that is. That's the sound waves. It produces the pictures of the thyroid gland to see its size, shape, whether or not it's inflamed. And then the fifth one's my favorite. It actually determines whether or not your thyroid is overactive or underactive due to the thyroid stimulating hormone. And they'll actually give you thyroid stimulating hormone. And it says, just to see its effects, they'll give you some thyroid stimulating hormone. And if your thyroid responds in an overactive way, you probably have hyperthyroidism. But if there's a very low reaction to the TSH, then you probably have hypothyroidism. Thyroid disorders affect the exercise response. It depends on the disorder, whether or not it's hyper or hypothyroidism specifically, and the severity of the disorder. Concentration of T3 and T4 have actually been shown to play a role in heart contractility and how hard the heart can actually contract. So hypothyroidism is a low ability to contract, and hyperthyroidism is an over ability to contract. But it's because those T3 and T4 actually play a role in calcium uptake, which will affect how muscle cells contract, because you need calcium to get your muscle cells to contract. Okay, we're going to move on to treatment. There are medications you can take to treat your hyper or hypothyroidism. You can have something called methimazole that slows the T4 and T3 production, and that's for hyperthyroidism. And what's interesting is I've seen drugs that it says that people will actually wean their doses off, and then you'll go in and be reassessed, and it's possible that you don't actually have to continue treatment for hyperthyroidism, that in those situations you can actually train your thyroid. But for hypothyroidism, they haven't found any drugs or anything yet that you can take and then train your thyroid to be more active to the point where you don't have to take those drugs anymore. So people with underactive thyroids are consistently every day taking artificial T3 or T4. Another treatment you can have is for generally hyperthyroidism or thyroid cancer, and that's lobectomy, which is when they remove one half of the thyroid, or a total removal, which is if you have very, very bad cancer. But your doctor will assess you and tell you what kind of surgery you should get. Okay, this is the case study I created. Alessandro is an obese 51-year-old sedentary male. He has type 2 diabetes. His glucose when on medication ranges from 100 to 120 because he does a really good job managing his diabetes. His father had a heart attack at 77. His HDLs and LDLs are 57 over 117. He wants to go hiking with his son a couple times over this upcoming summer, but he doesn't feel he'll be able to deal with his joint pain during those 2 or 3 hour long hikes. He would also like to reduce his BMI from 32 to 23 because he's pretty heavy. He's pretty heavy, and he wants to build some strength. But he does conveniently have a stationary bike at his house. He bought a couple months ago, but he doesn't actually use it. These are the actual static measurements you can take from that paragraph. 51, male, father MI at 77, BMI 32, type 2 diabetes, non-smoker, sedentary lifestyle, 57, HDL 98, LDL. He has high blood pressure. It's 141/91, which is stage 1 hypertension. He's got hypothyroidism. His goals are to reduce his BMI, go hiking with his children, and build some strength. His risk stratification, his category is automatically high because he has not just one but 2 metabolic diseases. His positive risk factors are his high BMI, his stage 1 hypertension, and his sedentary lifestyle, as well as the fact that he has those 2 metabolic diseases. These are the special considerations for exercise prescription when dealing with somebody with diabetes and hypothyroidism. For diabetes, you want to avoid the Valsalva maneuver when lifting weights. You want to check the blood sugar before long duration exercises, and then make sure they eat something before, depending on if they aren't in the proper range to actually exercise. And for hypothyroidism, you want to do some low impact aerobic activity because you don't want to aggravate the joints even more, because generally there's pain, swelling, and achy joints in people with hypothyroidism. For the exercise prescription, I have him do 5 45-minute sessions of 40 to 60 VO2 max of brisk walking every week, or stationary cycling at his home for the same intensity and time. For strength training, I want him to do 2 days a week of complete body workouts, 5 exercises for each major muscle group, 3 sets of 12 repetitions at about 50% predicted 1 RM. We're not going to actually RM test him because he has diabetes. I want him to control the weights on his concentric and eccentric phase, no jerking motion, not very high intensity, no holding his breath. For his aerobic exercise, I have him doing such a high volume to help him lose weight. It's recommended that you do around 150 minutes of aerobic activity a week. For people with diabetes, I'm having him do 225 total minutes, just so he can burn a lot of extra calories, and it will help him lose weight. I also will recommend to him that he changes his diet a little bit, tries to reduce his caloric intake a little bit to help him reach his BMI goal. This is his strength training exercises and specifics. I'm not going to get too into it because it's not very difficult to understand. You have an upper body push, an upper body pull, and then legs, and I want him to do all of this in only twice a week, of course. I have 5 exercises that are very general, large muscle groups for each group, and I want him to do 3 sets of 12 reps again. And then I want him to go to do afterwards, after he does his aerobic training and after he does his strength training, I want him to stretch to try to help his flexibility because he is aging and he has joint problems also. And I don't want him hiking with very tight muscles. And that's my entire presentation, and I got all my information about hyper and hypothyroidism from these websites. If you want to learn more, it's pretty interesting for what we know so far about the thyroid and how it works and regulates our metabolism. You can go check it out. Thank you.